Here's a number that should stop you cold. Up to 60% of potential admissions are lost, not to bad clinicians or bad outcomes, but to friction. The delays, the paperwork, and the missed calls that stand between a person in crisis and the care they need. Admissions friction quietly drains revenue and keeps vulnerable people from getting help. Here are 5 ways to remove it. First, find your friction points. Most bottlenecks build up slowly until they just feel normal. The biggest one is lead response. Leads contacted within 5 minutes are 21 times more likely to convert than those reached after 30. Yet many centers only answer during business hours, missing the evening and weekend calls when crises actually happen. Add slow insurance verification and overwhelming intake forms, and you can see where patients slip away. Second, win the first 5 minutes. Addiction and mental health crises don't keep office hours, so build round-the-clock response through an in-house rotation, a behavioral health answering service, or an on-call system. Give your team standardized scripts and crisis training so every first call does 3 things: build rapport, assess safety, and give a clear next step toward admission. Third, streamline your intake. Don't bury families in paperwork during the worst week of their lives. Gather information progressively. Safety first, then insurance, then the deeper clinical history over time. Use mobile-friendly digital forms with autosave and electronic signatures. And run your steps in parallel. Verify insurance while the clinical assessment happens, and assign a bed while financial counseling is underway. Sequential processes create delays that simply don't need to exist. Fourth, let technology remove the barriers. Manual insurance verification can take 24 to 48 hours, long enough to lose a motivated patient. Automated verification checks coverage in minutes. Intelligent lead routing sends each inquiry to the right counselor based on specialty and availability. And automated caring follow-up keeps families engaged without burning out your staff. Automated doesn't mean impersonal EBRA. It frees your people to focus on the human moments that matter. Fifth, measure, train, and keep improving. Let the data lead. Track your time from inquiry to first contact, your conversion rate by source, and your total days in the admissions pipeline. Cross-train your staff so a single absence never becomes a bottleneck. Then audit the process every month. Even mystery shop your own admissions line to feel what families feel. Reducing admissions friction is one of the highest impact changes a treatment center can make. It lifts your census and your revenue, and it gets people into care faster when it matters most. HITJMS brings your calls, your insurance checks, your lead routing, and your admissions data into one platform built for behavioral health, so nothing and no one slips through the cracks. Visit hitjms.com and book a free demo.